Hi, I'm Stephanie Nothelle. I'm a geriatrician at Johns Hopkins, and I'm excited to tell you today about some of my research about patients with dementia and keeping them out of the emergency department visit and hospital. We know that people with dementia visit the emergency department and are hospitalized much more frequently than their peers, but we don't know very much about how to support these patients and their families to keep them out of the acute care setting. With our research, we aim to identify potentially modifiable factors amenable to health systems intervention that, if intervened upon, might help prevent the emergency department visit or hospitalization. To do this, we use data from the Johns Hopkins Health System electronic medical record from 2017 to 2022. We included all patients who were 65 years of age and older who had a diagnosis of dementia and at least one other chronic condition. Patients included also had to have a potentially preventable emergency department visit or hospitalization. We identified these using an algorithm from the Agency for Healthcare Research and Quality. This algorithm uses diagnosis codes from the hospitalization or emergency department visit to identify visits that might have been prevented with timely access to high-quality outpatient care. So an example of a visit that might be identified is an emergency department visit for hypertension. Two researchers then read all of the outpatient clinical notes and patient portal messages in the 30 days leading up to the acute care visit. The researchers used a qualitative content analysis approach to identify themes about potentially modifiable factors leading to that acute care visit. In total, we identified 130 patients with dementia who had 179 notes and 284 patient portal messages. We identified four main themes. These were medication management, issues with care coordination, challenges with chronic disease self-management, and issues with access to care. While I don't have time to go into each of these in depth, I'll briefly give you two examples of issues and health systems interventions that might address the issues identified. Regarding medication management, we consistently found in our data that there is a need for high-quality medication reconciliation. This includes addressing issues with adherence and cost of medications and making sure that all of the medication lists are consistent across settings, including in the home. Regarding care coordination, we found that it was important to make sure that all members of the care team are on the same page regarding issues that the patient and family are having with chronic disease self-management. For example, we saw a case in our data of a person with dementia who was seen in primary care, and the primary care physician noted challenges with using insulin, but then the patient was seen in endocrinology clinic, and the endocrinologist intensified the insulin regimen. Unfortunately, this patient was ultimately hospitalized with low blood sugar. Better communication across the care team might have prevented this visit. While we're still finalizing our research, we hope that this and future research will help give us tools to keep patients with dementia and their families safely out of the hospital and emergency department and in their homes. Thank you.